Smith. I'm the Senior Associate for the SNAP ENT program here at the partnership. We are joined today by some amazing people. They are experts in this field, and they are with the Seattle Jobs Initiative. We have Bob Thibodeau and Susan O'Callaghan. In just a sec, they will pretty much take control of the webinar and engage us and educate us on this program. First thing, so next week, today's session actually is to help explain the federal SNAP ENT program and kind of give you a general overview and have you guys start thinking about potentially getting involved with our project. And then next week on April 1st, What's in It for Me is another webinar that will take us into a deeper dive, exploring the partnerships, the project, and what's in it for you. So just some housekeeping things before we get going. You guys are all muted. You will have a chance to ask questions at the end, and you can unmute yourselves then. And you can always put questions into the chat throughout the session. Today's session is recorded, as well as next week's session will be recorded. In a few days, the sessions will be available on the partnership website under the Tools and Resources page. And then you follow over to Webinars, and there they are. Okay, so one of the questions you guys might have is going to be some funding questions, and I think you're in the right place. But there could be some other questions that are maybe a little bit outside the scope of today's goals. And so we're going to maybe put those in a parking lot, and I will follow up with you later. And they might even be more appropriate for next week's webinar. So I'll make sure to bring those back up. But I know you're going to have a lot of questions. I think one of the carrots I'd like to put out there is, should you join our cohort and join this project with us, one of the benefits is an individualized, state-focused SNAP ENT partnership roadmap, plus some ongoing specialized training and technical assistance throughout the whole project. So it's pretty cool. So, okay, I'm going to stop talking and turn it over to our experts, Bob and Susan, and I think Bob is up first. Thank you.
Yeah, thanks, Steph. Yeah, this is Bob Thibodeau with Seattle Jobs Initiative. I'm a SNAP ENT senior consultant here. I've been here for a little over 5 years now. I have about 10 years experience with the SNAP ENT program. I managed the Washington State Basic Food Employment and Training Program for several years, and have been, like I said, working with Seattle Jobs Initiative in doing consulting work. And we've been in about a little over 25 to 30 states, I guess, right now in helping different states build up their SNAP ENT programs. So both Susan and I have been doing this for a while, and have, hopefully I'll have some answers to your questions you might have at the end. So we'll go ahead and get started. So this is what we're going to cover today. We're going to first talk about what is SNAP ENT, basically kind of go over a program overview, talk about how it's organized, and then who's eligible for the program, and kind of how the funding works. And then we're going to dive into third-party partnerships, what they are, talk about how that reimbursement works in the third-party partnership. And then I'm going to turn it over to Susan, and she's going to talk about third-party partner roles in SNAP ENT, and how the referrals and the third-party partners are involved in that referral process for getting participants into the program. And then Susan is going to go into different elements that make up kind of the best opportunity for third-party partners to take advantage of that 50-50 reimbursement, to get that funding to help kind of enhance your programs and increase access for your programs. So let's go ahead and just dive in here. So first of all, you're probably wondering why the Food and Nutrition Service, under the SNAP program, is running a workforce development program. Well, in the SNAP program, there's certain people that are have the capability of working, have different work requirements to be able to get SNAP benefits. So in order for them to kind of meet those requirements, the SNAP program created the SNAP Employment and Training Program. And each state has to run a program. It's really up to them how large, how small they want that program to be, but they're giving funding to do that program. And I'll talk a little bit more about that funding and break it down for you in a few minutes. But the USDA provides about $350 million annually to states to operate their SNAP Ent programs. That figure is for a couple of years old now, so it's probably closer to 400 million nowadays. In 2018, SNAP Ent served just under 458,000 participants. Again, that number's probably gone up significantly in the last couple of years because we're adding more and more states are adding third-party partners like yourselves to their programs. Like I mentioned before, states really have a lot of flexibility in designing their ENT programs. They really want to meet the needs of their participants within their state, and also, meet the needs of the different employers within their state, so they can help fill those jobs that are kind of hard to fill for them. This kind of shows you the relationship between the USDA Food Nutrition Service, the state, and then the different third-party partners. The bottom line is it comes down to is the state is primarily responsible for the program. They're the ones that are the pass-through for the funds from USDA. USDA also counts on the state to make sure that all the regulations and the rules of the program are being followed, not only by them, but by the third-party partners. So the state is responsible for that as well. So it's really important that they relay all that information down to the third-party partners, but it is really a collaborative program. They work closely together with the third-party partners to make sure that everybody has what they need to run the program correctly. So the main part of the SNAP Ent program is that state plan. Like I mentioned before, each state has to run a program. They also have to submit a state plan every year. And what's that state plan contains is the state puts in what their vision is for their program within their state, because they do have that flexibility. They decide what their vision is for the program. If they plan on growing the program, in other words, adding third-party providers like yourselves to the program, they mention that in the state plan. They also talk about what role their third-party providers will play, what components they're going to be offering, how much of the 50% reimbursement they're going to need, and how many participants they're going to be serving in each of those components. The planning cycles, the state plan is due August 15th of each year, so the state has to, when they plan that, kind of go backwards from there and decide how long it's going to take for each of the different parts of that. How long they need to allow the providers to get their plans into them, and then, like it says here, typically a partner will have to submit their proposal and their budget and everything by June of that year, so the state can get their plans in by August 15th. And then the federal fiscal year is really the program cycle for that state plan. It goes from October to September. Also, states are allowed to put in plan amendments during the year. So if things change, if they want to add new partners, or if the proposal that the partner put in at the beginning, if things change, then they're allowed to change that in the middle of the year and put in an amendment. They really can't commit the funds to the providers until that state plan is approved. And then once they do that, the state will contract with the third-party provider and then implement that proposal. So who's eligible for SNAP Ent? It's any SNAP recipient who's receiving SNAP benefits in the month that they participate in a component. The only exception to that is the job retention component. And what that is if somebody is receiving SNAP Ent services and they become employed If for some reason, once they become employed, their income puts them over the income limits for receiving SNAP benefits, they can still get help through the job retention component for up to 90 days after that. The person cannot be receiving TANF cash assistance at the same time they're getting SNAP Ent assistance, and they must be able to work upon completion of their different components. Unlike TANF, SNAP Ent and SNAP do not have any participation time limits, so there's no like 60-month time limit like there is in most TANF programs. And then states have the option of being able to operate either a mandatory or a voluntary program. And more states are turning to voluntary programs because they're a lot easier to administer. So getting into the funding here, there's basically 3 buckets of funding that come down through the Food Nutrition Service. There's the 100% funding that is a capped amount. It's based on a formula grant. There's $103.9 million for the country, and that is allocated out to each of the states based on that formula. And the formula has to do with the number of what's called work registrants within their SNAP program, and these are again work-capable adults between the ages of 16 and 59 that are in their caseloads. There's a subgroup of that called able-bodied adults without dependents, and that's a group between childless adults between the ages of 18 and 49 that are capable of working. So that, again, those numbers are what determine how much a state is going to get out of that 100% fund pot of money. No state gets less than $100,000. Before the 2018 Farm Bill, it was $50,000. And then there's also a pot of money called the ABOD Pledge Funds. There's a $20 million pot of money where states can opt to put in a plan to serve all at-risk able-bodied adults without dependents. And at-risk means that because there are time limits for those folks on the amount of food benefits they can receive without meeting one of the work requirements, they're considered at risk. So states will pledge a certain amount, try to get a certain amount of money out of those pledge funds to help those people. Then we have the 50-50 funds. There's no cap on those funds, and that's really where the biggest potential is for growing the program. And I'm going to break it down a little bit more here in a minute to show you what you can use those funds for. But I think one of the goals we have for the work that we do is really to make that first statement up above untrue, that states are not currently maximizing the use of Ent funds. We would like to see them maximize the use of those funds, including the 50-50 funds. And the only way they can do that is by partnering with agencies like yourselves. So the 100% funds are really there for states to help them administer the program. Any administrative expenses that they have, like paying for staff salaries, their fringe, the overall planning and implementation and operations of the program. They can also use it for direct program expenses, tuition fees for any education or vocational training programs individuals might get. They use it for case management, career navigation, job development. Again, there's a capped amounts for each state based on that formula, and they cannot pay for participant reimbursements or supportive services such as transportation out of the 100% funds. So the 50-50 funds, again, that's where the real potential is for the growth of the program. It can cover anything that the 100% funds cover as far as administrative cost. In addition to that, you can use the 50-50 funds to cover the support services like dependent care, transportation, books. It's really extremely flexible. There's a lot of things you can do with that funding to help, kind of meet those needs, lift those barriers that people have in participating in the program. And the main thing about this is that the fact that we're not asking third-party partners to develop whole new programs or whole new set of services for individuals. They're usually already spending this money on the people that they serve. So this is a way for them to get some of that money back. So what is a third-party partner? Again, it's an agency that contracts with the state SNAP agency, or if it's a county administered state, they'll contract with the SNAP county agency. It's also referred to as a third-party reimbursement program, or the 50-50 partnership. The ET services are provided by the third-party partner, such as the community action agencies. And then you're going to be reimbursed 50% of allowable services that are provided to SNAP Ent eligible individuals. And as long as those services are funded through their own non-federal revenue. So the way the money flows is, again, once that state plan is approved and the agency, the SNAP agency, contracts with the third-party provider, they draw down the funding from the federal government that is approved in the state plan. And then the third-party provider provides those services, and then they bill the state for those services. And then the state agency would then issue the payment to the third-party partner with 50% reimbursement. So now I'm going to turn it over to Susan to talk about kind of some of the roles that a third-party partner can play within SNAP Ent. Susan?
Thank you, Bob. So this first slide, like Bob mentioned, I'm going to start talking about how a community action agency can participate. Mostly, I'm going to focus on the 50-50 funding model. This slide you'll see does talk a little bit about 100% funds, and I'll explain that. But mostly, we're talking about 50-50 here, because that's really where the potential is for program growth. So a CAA, I'm going to refer to community action agencies as CAAs. They can contract directly with the SNAP agency to directly provide services to their participants through SNAP Ent. And in this case, the CAA would be considered a SNAP Ent third-party partner, drawing down 50% federal reimbursement for any non-federally funded SNAP Ent services. The CAA can also play a variety of different intermediary roles. And again, that's kind of what this graphic is trying to demonstrate here. And first, let me mention that an intermediary isn't formally defined. I think there's a lot of conversation about intermediaries, and it really isn't there's no formal definition within the SNAP Ent world for what that is. And it can look a little different each time depending on what the program needs. Intermediaries aren't necessary, but they can be helpful for situations where the SNAP agency, either from the state or the county, has an interest in expanding their providers beyond what they could sustain administratively. An example of that is that often is a good model for college systems in a state where there are multiple colleges. And if they have a lead college or a governing body like a college board who can sort of umbrella all the individual contracts of maybe possibly dozens of community colleges, then the state only has to interact with that one umbrella entity, and they don't have to manage those individual contracts. Another example of where an intermediary can be really helpful is when a smaller agency who might offer really important services or reach a really specific population in the community, but they don't have a lot of administrative capacity. So they could operate under a larger umbrella agency who is either not offering any direct services under SNAP Ent, or they might also offer direct services in addition to their subcontractor community action agency. In some cases, SNAP agencies might offer 100% funds to support the administrative functions of an intermediary who is taking on some of the state's administrative burden. I think the point is to know that it's helpful. It's helpful to know that using an intermediary is allowed, and it's often advantageous, but it's also important to consider why it might be necessary and to think through that before immediately thinking that that is the only model or a necessary model. And the things to consider are really whether the model relieves administrative burden on anyone to merit some of the added complexity that can come with that model. Next slide, please. Oh, can I advance slides? I don't believe I can. Thank you, Bob. So now I'm going to move away from different roles that a community action agency can play and talk more about how participants get into receiving services through Snap Ent through a third-party provider. And this diagram outlines two different referral processes. The first is called direct referral, and the second is called reverse referral. So direct referral means that the point of entry into Snap Ent for an individual is the Snap agency itself. So imagine a person goes in to apply for Snap benefits, and the Snap agency then screens and verifies their eligibility for Snap Ent at the same time, and then enrolls them into Snap Ent by referring them directly to a Snap Ent service. And that could be a third-party provider or other services that might be offered at the Snap agency level. So that's called direct referral. And for third-party providers, that can be a source of Snap Ent referrals, but most often the referral process for a third-party provider is called reverse referral. So that's the bottom diagram, and that refers to when a person comes into your program, your community action agency. That's their point of entry, and then your agency will then assess and determine that individual's fit for the services you offer, and also Ent services. So sometimes that individual might need to go apply for SNAP. So that might be part of the process, that they have to actually become a SNAP recipient first, or it's a process of verifying that they're on SNAP. Either way, that process has to involve communicating with the SNAP agency to refer them into Snap Ent. So, but the important thing to see here is that the point of entry is through your doors, through your agency doors. And that the reason why there's the opportunity really lies there is that if you're a Snap Ent provider and you're a fit for Snap Ent, it probably means that you are serving people who are eligible or can be eligible for Snap Ent. And if you think about who, if you're wanting to serve low-income individuals who are likely on SNAP, then that's the population that's a good fit for Snap Ent. And if you're offering employment services, then that's even more likely that this is a good fit. And so that's where your participants are going to come from. They're going to come through your doors. Next slide, please. So this slide kind of zooms in on that verification process. So in the reverse referral model. So say you have a potential participant come through your doors. You're going to do whatever intake process you already have. And I really want to emphasize that a lot of these processes that we'll talk about can kind of map onto what you already do. So again, Bob mentioned that's sort of the beauty of Snap Ent, is that you don't have to necessarily rethink everything you do. A lot of what needs to happen can map onto what you already do. So within your intake process, you would be assessing them for eligibility to receive the services that you have to offer, but then also to assess for their SNAP and then Snap Ent eligibility. So say they do fit into your program and you want to enroll them into your program. At that point, you're going to then communicate some way with the SNAP agency, and those methods are all usually sort of determined and it's kind of built out by the SNAP agency. So as a contracted provider, you'll be given the process by which you have to do that. Sometimes some SNAP agencies actually let their providers look into their case management system. And so the verification process is electronic. A lot of other programs, you're exchanging spreadsheets with lists of individuals on them, and they review those individuals and then communicate back to you to verify that they are eligible and have been referred into SNAP Ent. So the next part of the process, though, is ongoing verification. So thinking back to who's eligible for SNAP Ent, you have to be on SNAP in order to be able to participate in SNAP Ent. And that eligibility can fluctuate over time. So providers have to build in a process to continually verify the eligibility of their participants before they can be reimbursed for those services that they've offered them. So that usually happens on a monthly basis to coincide with the timing of how you're invoicing for your SNAP Ent reimbursement. Next slide, please. So we've shared this diagram earlier in the presentation, and we're going to focus on all these different elements a lot in the next few slides. So Bob also mentioned, like, if you look at sort of where all of these different elements converge, that is where the best opportunity is to be a third-party provider and to receive and to be reimbursed for the services you're offering. So we have one element is having the right funds. So that would be non-federal funds, and we'll talk more about that in the next few slides. And then the right capacity, we're going to explore what it means to have the right capacity. And then the right participants, again, we'll just review what it means to be eligible for SNAP Ent. And then the right services. So what services do you offer that map well onto the services that fit within SNAP Ent? Next slide, please. So the first circle we'll talk about is funding, and that's often the most interesting one. So again, in the 50-50 model, this is a reimbursement program. So you have to spend the money first in order to get the reimbursement. And the money that you can spend has to be non-federal. It also can't be used as match for another federal grant. So some, if you receive other federal grants that require like a 25% match and you've carved out some of your non-federal funds for that in your program budgets, those can't be touched to draw down SNAP Ent reimbursement. Some common examples of non-federal funds could be any funds that you receive from the state, county, or the city, private donations and foundation grants. For social enterprises, the revenue they generate through their businesses can be used. And then for community action agencies, I think one of the important sources of funding is community development block grants. And some of you might be thinking, but those are federal. That is true, but this is the one source of federal money that actually loses its federal status for the purposes of drawing down SNAP Ent. So that is great news, I think, for organizations who receive CDBG funding. Next slide, please. So the next circle we'll talk about is participants. And again, sort of at the most basic, they are SNAP eligible. Not receiving TANF cash. TANF has its own employment program, so they're excluded from SNAP Ent. And then able to work, and that really means that, you know, work is a goal for this individual, and it's not, and it's part of kind of their plan to become employed, as well as their sort of ability to become employed. And so providers are often assessing that. It's not exactly, there's no specific definition of what it means, but I think the way that comes into play for service providers often is, you know, if somebody comes in and maybe their barriers are such that work is going to be detrimental to their health or the benefits that they have to be receiving. There's all kinds of decisions that have to be made, but basically work has to be the end goal of this program. Next slide, please. So the next circle is services. So this list is these are what in SNAP Ent we call components, but really they are just the kind of the menu of services that are provided under SNAP Ent. And what I'd like for you all to do as we review what each of these what these are is just think about what the services that you offer, and they may not have the same name, but see how the services you offer kind of map onto this list, because often if you're an employment program, it's pretty likely that all or at least some of what you do is sort of captured in these components. So I'll go over these really quickly. Supervised job search. So this refers to, you know, activities that are done with the support of your program to help participants look for employment. I think the important thing to recognize here is that it has to be supervised, which means that, you know, there needs to be some support and advising that go along with that activity. It has to be kind of more robust than offering somebody a place to go online and look for work. And then job search training can be any of the sort of classroom work that they're doing to understand the job market and to sort of gain the skills that will help them look for jobs. Work experience. So if you're offering, this is a common one for social enterprises who operate a business and have some venue for their participants to actually be employed and learn on the job. That's what that component is about. It's similar to on-the-job training, where you're actually performing the functions of a job as part of your training activity. And then education, so that is all education that's all vocationally contextualized within employability and employment, so skills training. You know, colleges, obviously, this component is important, but it could be any sort of educational opportunity that somebody might be participating in. Certifications, that sort of thing. Self-employment, that component is for individuals to learn skills to start their own business. And then job retention, that component allows you to offer support for an individual who has participated in a SNAP Ent activity and then has become employed, and then they are able to receive a certain amount of support after they become employed to help them keep their job. The great thing about this component is that this is the only SNAP Ent component that you're still allowed to offer and get reimbursed for those services for that individual, if that individual's employment income makes them ineligible for SNAP. So that's an important component to think about. And then kind of on top of all of these different activities, case management needs to also be integrated into what you're offering. So again, you know, the assumption is that everything that SNAP Ent participants are doing, they're also receiving some individualized support along the way. So again, I want you to think about, you know, even if your services don't line up with these names, think about some of the work that you do, the services you offer, and how they might map onto this list. Next slide. So the next circle is the right services. And in this case, we're talking about, I'm going to call it wraparound support or support services. In the SNAP Ent world, it's called participant reimbursements. So you'll hear that terminology, and it really just means support services or wraparound support. These are some of the common allowable support services under SNAP Ent. Transportation is a big one. So that could look like transit fare to get to and from a job site or a training site. Clothing that's required, appropriate clothing that's required to do the, to participate on the work site, or tools and supplies. Tuition is a big one. Childcare is also a really important service. And then there are other ones. Emergency housing is that really means if somebody is about to lose their home, maybe they got an eviction notice or something like that, that SNAP Ent can provide a temporary emergency support so the person doesn't lose their housing. Something to kind of remember, just sort of a general rule around SNAP Ent support services, is they have to sort of fit the reasonable and necessary standard. So thinking about you know, the level of services, support services that you're offering, sort of look at them through that lens of reasonable and necessary. Next slide, please. So capacity. On this slide, we'll talk about data and reporting capacity. So this means that you have the capacity to conduct assessments and create employment plans for your participants, track their progress, create case notes, track their component activity, and be able to report on their outcomes. So, you know, for a lot of organizations, they're already doing this kind of work because they have to track this kind of stuff for their participants for either other funding programs or just for their own internal tracking needs. So again, this doesn't mean that you have to develop an entirely different process. It might just mean that you have to review what you currently do and make sure it fits within what's necessary for SNAP Ent. Next slide. The other piece of capacity is the administrative and fiscal capacity that's needed. So this is the ability to have a process for documenting support services, general like federal funds management, knowing some of the requirements for managing a federal grant, being prepared and having everything in place to be audited or monitored. That is one thing. If you participate in a federal funding program, that's just one of the realities. But again, it's, you know, if you have experience with federal funds already, then this is nothing new, and it's very similar to what you might already be prepared to do and positioned to do. The other piece, though, because this is a reimbursement program, it does require you to put some thought into your budget ahead of time and to make a forecast of what services you're going to offer and the level of service you're going to offer and how many people you're going to serve. And then you're basically invoicing on those actuals. So having sort of the capacity and being prepared to kind of think ahead and think about what you project you're going to be able to do, and then have a process to back up what you actually do for the purposes of invoicing are going to be really important. Next slide. So a few tips for success. The first tip that we would offer is to really, if you're thinking that after all this information that your program could be a good Snap Ent third-party provider, really think in terms of what you already do. Start small, start kind of with what's obvious. And that gives you the opportunity to really focus on getting all of your processes down, understanding all of the regulations that come with this program, understanding what's required from your state SNAP agency, and not worrying about, don't bite off more than you can chew, is really what that means. The next bullet there is embrace collaboration with your SNAP agency. So this is a collaborative program by nature. The SNAP agency can't achieve their goals of serving SNAP participants without third-party providers, and they're there to support your success and to also hear your feedback and to help make changes along the way. And you need them to understand how to operate this program. So really make sure that you have established good communication lines with your SNAP agency. Use the materials they offer as guidelines, ask questions, and keep those lines of communication open. Participate in any opportunities they offer to collaborate on how the program is run, on strategic planning, that sort of thing. And then the next thing, integrate Snap Ent into what you already do. And this is sort of maybe a sub bullet of starting small also, but this is not this isn't the time to think about what's brand new, what can I do? Don't reinvent yourselves. You know how to serve the people that come in your door. And that is really what makes this program so great, is that nobody has to do what they don't do well. And that's exactly the role you need to be playing, is to just do what you do well and integrate Snap Ent into what you're already doing. And then, the eligibility verification process is key, because you have to verify that your participants are eligible in order to get reimbursed for the services you offer them. Establish and document the processes that you use to do that. Also, the same thing for just your managing federal funds. Establish, document those processes. Their state agency is going to want to see how you do those things, and that will often be part of what gets reviewed when you're being monitored. And then train your staff and make sure you've engaged the right staff to do this program well. And that would be your direct service staff, your frontline staff, your administrative staff, program assistant staff, data staff, and fiscal staff as well. So make sure you've engaged all the right people within your program to carry out this program well. And that is my last piece of advice. And I think we have some time for questions.
All right, thank you so much, Susan and Bob. We do have several questions that have come in the chat. So I'll go ahead and field some of those to you. So one of them was about the age limits for SNAP Ent 50/50 eligibility. So are there upper age limits for that, such as someone 65 or older who wants to work?
Yeah,
Um,
this is Bob. Yeah, there's no upper or lower age limits, but because of the flexibility of the program, some states do establish age limits for their particular program. But at the federal level, there are no age limits. But again, it's you know, what Susan spoke to before, as far as, you know, are they able to work at the end of the training that they're doing, or the whatever services they're receiving. That's the end goal of the program. So it's important to keep that in mind. For example, somebody that's you know, enrolled in high school, really their main goal is to complete their high school and get their high school diploma. Uh, Not really sure we want somebody who's, you know, especially under the age of 16, you know, enrolled in this program when we know for sure that they're probably not going to be ready to go to work at the end of that program. Anything you want to add?
I think just speaking to the other end of the spectrum there, you know, definitely older workers are certainly eligible and able to benefit from SNAP Ent, and I think it is important to consider what the potential is for their participation and success and their needs. And yeah, there's no age limit. If they're needing and able to work, then SNAP Ent can really benefit them.
Yeah, one of the things that may cause a state to, you know, kind of put age limits on their programs is their capacity to serve those people, as far as the support services, the participant reimbursements, because they have to provide those to all their participants. You know, they have certain limitations on what they can provide, so that sometimes causes them to put age limits on their program. I hope that answers
Okay.
your question.
Yeah, thank you. Then another question that came in was about the wraparound services and whether those are also reimbursement based.
Yes.
Okay.
Yeah, there are specific wraparound services that are not. The list that we offered on that slide are not exhaustive of what's allowed, but there are some things that wouldn't be allowed, and we can offer, you know, point you to materials that give a more exhaustive list. States can also put limits on that, and I think if you were to become a SNAP Ent provider, that there is, you know, that would be a conversation you'd want to have with your state agency to understand if they have limits on those things that are kind of beyond what the sort of federal limits are, and to explore why that might be, and to see where that might even be changed if you're offering something that's really important and offered at the federal level. Again, going back to communicating with your SNAP agency.
Okay. Thank you. So another question is the Community Action Agency able to assist with the SNAP application process, and how involved can they be?
Certainly, I
They
mean,
can't. Go ahead, Bob.
go ahead.
Oh, we're probably going to say the same thing. And Bob, you can
Probably.
certainly speak on the policy. They definitely can. However, that isn't a SNAP Ent activity. So
Right.
you can definitely support a participant to get on SNAP, and you would have, you know, a lot of programs, obviously, that's an important benefit to offer the people you serve. It's just not a SNAP Ent activity until they're actually referred into SNAP Ent, and it's just not allowed. You can't be reimbursed for the work you do to get them onto SNAP.
Right, not out of SNAP Ent, but each state has the opportunity to put in a state plan for a SNAP outreach, which means they can draw down funds to partner with community agencies to assist with SNAP applications. So you could get reimbursed through the SNAP outreach program if you become a SNAP outreach partner.
Okay. And then another question, how do you know if there are other SNAP ENT providers in our area?
Normally, this state SNAP agency or the county SNAP agency let you know that when you're. But many states have websites that show where their providers are located. But it's not. The thing is, it's not a competitive process. You know, again, like Susan mentioned, it's a collaborative program. And it's not only collaboration between the third-party partner and the state, but it's also collaboration between the third-party partners that are involved in the program. So they're really working together to kind of provide some good robust services and kind of so kind of serve the whole person. So one agency may not have certain services a person needs, the other agency could have have those services that they need, or those opportunities that they need. So we really encourage co-enrollment into different agencies as long as those agencies are not providing the same service at the same time to the same individual or the same component.
Okay. Thank you. I know that the partnerships in the process of trying to pull together some of that information as well, as far as who all is doing that kind of work. So let's see. Going to another question. Does the provision of supportive services and employment and training components have to come from the same provider?
I think
No, again, that's kind of the beauty of the program.
Okay.
Yeah, exactly. The co-enrollment and the collaborative process, that's where that would come into play. So the answer is no, it doesn't have to come from the same agency, and many times it doesn't.
I think one of the partnerships that might be, work really well for like community action agencies is if you're offering a lot of like case management and wraparound support for an individual who then might also be enrolled in community college, that can be a really good partnership and a good model for co-enrollment.
Okay. And let's see, there's another question. It seems like a clarifying question of something you talked about earlier. Emergency housing support would only be reimbursed at 50%. Is that correct?
Correct.
Okay. And then we had another question about leftover money at the end. Why is this leftover money at the end of the fiscal not being given as bonuses or even raises?
Are you referring, I think, so there's leftover 100% funds that states may not run through. And that is, I think it just has to do with the cycle of how the funding gets used and reported on. And then I know states are encouraged to think as early as they possibly can about what might not be utilized in order to kind of recirculate that money around, because FNS creates opportunities for that. And I guess I would ask if that was the question that was being asked. When we're talking about 50-50 funds, there's not really, funds are left over in the sense that if the state doesn't pull down all of the reimbursement that they project in their state plan, that can be problematic because we don't want to tell Congress that we didn't need all that money, because that could have an impact on how those funds get authorized in the future. So states definitely want to encourage their providers to be as accurate as possible in their budgeting. But I think there's also an understanding that new providers especially are making their best guess. And I think, again, that communicating kind of early and often with their state SNAP agency is really important, so that if they do feel like they're going to come well under what they budgeted for. Sometimes states will reorganize contracts or and look at kind of holistically what's happening in their whole state. If they have providers that are going well above what they budgeted, they may adjust contracts and increase one provider's contract and then reduce the other ones so that they don't have to go back at the end of the year and say, oh, you know, we budgeted for a whole lot more than we needed.
Yeah,
Okay.
getting back to the 100% funds, I mentioned at the beginning that that's a capped amount, but because not all states use up their 100% funds throughout the year because of one thing or another, once the books are closed for a certain fiscal year, the federal government will, offer those leftover funds. They have another year to spend those. They'll offer those leftover funds to states that have a plan for utilizing those funds. So states can put in a request for what they call carryover 100% funds to get more than what they were initially allocated for that fiscal year.
Okay, thank you. There's another question related to kind of fiscal aspects of things. Are staff dollars reimbursed?
Like payroll, I think is the question.
Potentially.
Yeah.
Margie, if you want to clarify that, you can enter in the chat again, but.
Salaries. And the simple answer is yes. However, you have to do some careful analysis of what part of that staff person's job and work is directly tied to SNAP Ent services. So a lot of staff people, like, we'll use a case manager, for example. They may have a caseload that's made up of SNAP Ent and non-SNAP Ent participants. So kind of at that highest level, they would already, you would already know then only a percentage of that person's salary could be used to draw down reimbursement. There's even further kind of allocation methodology that you need to use, given, what that person does on a daily basis. If, a certain percentage of their time is dedicated to allowable SNAP Ent activities, and then of those allowable activities, how many SNAP Ent participants were part of that mix. So there's kind of a carving out process, but yes, staff salaries are reimbursable. And not just direct service providers, administrative, any staff effort that's tied to SNAP Ent.
Okay, thank you. So I think there's about 2 more questions I'm seeing here. I know that we're coming right up to the top of the hour. We did have one person saying that we're already a community-based organization for SNAP. Would we be eligible to be in the cohort? Would we be a third-party provider being a CBO?
CBOs are definitely able to be third-party providers. Any questions about the cohort, I think, are could be further clarified by Steph.
Okay, great. Yes, we'll make sure that she is aware of that question. She had some connection issues. So then one more question I'm seeing here. Do states often use 100% funds to support administrative costs of providers or intermediaries?
No, not very often, but they can do that. They have that flexibility to do that. Many times what a state will do is offer some what they call seed funding to get a new provider, kind of get them going so they can kind of get off the ground. And that seed funding is usually meant to last maybe 3 to 6 months, and then it's expected that the provider will transition to 50-50 after that. Like I mentioned before, those 100% funds are capped, so the state only has so much of those coming in, and so it's the more providers they have in the state, the more kind of stretched thin they're going to be as far as their own administrative capacity and the money they have to put towards their capacity to keep the program going. So, Susan, you were going to say something?
Yeah, just to kind of add to that, I think what we would recommend is to really look at your potential from the 50-50 lens and consider 100% funds as a maybe added bonus if that's a possibility in your state, because every state kind of handles those things differently. And like Bob said, it's not guaranteed over time. So sustainability really hinges on the 50-50.
Exactly.
All right. Well, thank you all so much. I think we got all of the questions that came in. And I think this was a very helpful presentation. So we really appreciate you, Susan and Bob, providing this information. We did record this session today, and we will be sharing the slides after the event as well. We generally send these out within a couple of business days from the live event through a follow-up email, as well as post to the partnership website within a couple of days of the events. If you go to our communityactionpartnership.com resource library, and then you go to webinars, that's where you'll be able to find this recording within a couple of days. Or like I said, we'll send a follow-up email to all of the registrants. There is also a survey that is being conducted that'll be included in the follow-up email, I believe. Susan, do you have any further information on that you wanted to share?
I think that I know that the survey has probably been made available to some of you already, but I think Steph wanted to just sort of plug it again, that if you're kind of interested in participating further in the cohort, it would be great to fill out the survey. It helps us Steph and her team understand sort of who's out there and sort of the characteristics of your program. So there's an understanding of who's wanting to participate, and then also how technical assistance would be delivered. It kind of helps inform that piece as well.
Great, thank you. And we'll make sure that that's included in the follow-up so that everyone receives it and has the availability to engage in that and get any follow-up questions answered. Or if you're interested in the cohort, then we'll be able to follow up with you further that way as well. All right, well, thank you everyone again for joining, and thank you, Susan and Bob. Hope you all have a great day.
Thank you.